But again, when we think about the ways in which this basic concept has been distorted, I think sometimes taking a broader aperture and saying what's actually happening, what's happened in our country since we've instituted measles vaccines of some variety in the late 1950s, early 1960s. These are the number of reported measles cases on the y-axis. This is time on the x-axis. And the lack of blue bars here, I think, says the picture that there has been a clear correlation between vaccine uptake. And, you need communities to hit about 95% vaccine uptake in their communities to really rid yourself of measles spread. I mean, we talked about herd immunity all the time during the pandemic. That's the concept that bears itself out. If you have high rates of vaccines, of uptake of the measles vaccines in these communities, you're going to see this trend line, as we showed here, from the 1960s on up to 2020, where there's a lot of progress. And so that's why we're so focused on this. I will say, just to talk about it real quick, the safety profile of the measles vaccine, this gives me a lot of, especially because what ends up happening is children that are unvaccinated, perhaps living in communities where we know misinformation is rampant right now. We're seeing it in pretty astonishing and shocking ways. I'm having a response to this. I know many of you on the call are in healthcare and are doing your work, and we really appreciate this. This is a full team effort. But there's a lot of confusion, and what I'm being told and what we're hearing, sadly, is that some people think that the vaccine itself is the reason why we're seeing this outbreak. I mean, that is being directly stated by some entities. And one, it's wrong. Two, there's no evidence at all that the vaccine is frankly just even unsafe. There's no evidence that it causes anything in the way of serious side effects. This is really what it is here. I've laid it out. But the common vaccines side effects from the measles vaccine are what you would think. Injection site soreness, muscle aches, mild fever, all self-limited, all resolved within 48 hours. Very rare and treatable, just to put it all out there. Sometimes there's a low platelet counts that can happen in rare cases. Anaphylaxis, a severe allergic reaction, extremely rare, treatable, but there have been some case reports of that, which, by the way, can happen in a variety of medical instances to medications, other vaccines, and we treat that, but again, extremely rare. In terms of delayed reactions to the vaccine, sometimes you won't see any of these sort of injection site soreness or mild fever at all. Most people don't experience any of this, frankly. But in some cases, we'll see that there's a rash that can appear about 6 to 12 days after the vaccine is administered. Again, self-limited, goes away. Lastly, I'll just say this, and I'm going to kick it to Dr. Hoffman for his thoughts. Autism and the measles vaccine, we're talking about it again. Our current HHS secretary and the organization that is doing some of the leading misinformation in the space, the Child Health Defense, are talking a lot about this. Our current health secretary talked about it a lot before he became the health secretary. And I think it's important to contend and wrestle with the data as transparently as possible. This has been studied endlessly. I actually put a table here from the seminal paper that was published in 1990 in The Lancet, showcasing that this has been studied repeatedly. Is there a link between the measles vaccine and somehow increased development of autism? The answer is no. It's been studied repeatedly over the last 30 years. There's no need to relitigate the science. It's wrong and it's false. And it's important, I think, that all of us are on the same page on that, because you're going to see a lot of that get recreated, it seems, over the next 4 years.